National Asthma Education and Prevention Program was established in 1989. Their purpose is to bring awareness to asthma, develop clinical guidelines and programs to ultimately better the quality of life for asthma patients, and to decrease mortality. And their main goals are to raise awareness of patients, health professionals, and the public that asthma is a serious chronic disease, to ensure the recognition of asthma symptoms by the patients, their families, and the public, along with appropriate diagnosis, and to ensure effective control of asthma by encouraging partnership between patients, physicians, and other healthcare professionals through treatment and education. The National Asthma Education and Prevention Program has written out objectives for patients, public, and healthcare professionals. So for the patient and public, their objectives are to increase public awareness of asthma as a significant public health problem. So they want it to be more noticed that asthma is a very common health problem in the public. They also want to increase the public awareness of the signs and symptoms of asthma. They want to improve the knowledge, attitudes, and skills of patients regarding the detection, treatment, and control of asthma. This is particularly in high-risk populations. Define guidelines for effective asthma education programs. Promote development, dissemination, and use of patient and family education materials. For healthcare professionals, they want to increase the knowledge, attitude, skills of healthcare professionals regarding the signs, symptoms, and management strategies for asthma. Encourage health professionals treating the patients with asthma to adequately track and monitor the patient's status and to use objective measures of lung function. Assist and encourage healthcare professional schools and continuing educational programs to include up-to-date and accurate information on the diagnosis. So they want all of the schools and the programs that are teaching all of us healthcare professionals to be up to date with the current research and with the current treatments so that we can provide the best care for our patient. To promote and encourage the concept of active patient participation in the management of asthma. Develop resource and materials for use by healthcare professionals. And to promote research to answer unresolved questions about underlying causes of asthma and appropriate asthma treatment and management practices. Now, some of the key clinical activities and actions for diagnosis of asthma the key activity is to establish the asthma diagnosis. And to do that, we're going to use medical history and physical examination to determine that the symptom of recurrent episodes of airflow obstruction are present. We're going to also use spirometry in all patients 5 years or greater to determine that airway obstruction is at least partially reversible. And we're going to consider alternative causes of the airway obstruction before we just go ahead and diagnose asthma. We want to make sure we rule out other things as well. The long-term management of asthma. The goal of long-term management is to just control the asthma. Asthma is not curable, so our main goal is just to better their quality of life and keep the symptoms under control. So to do that, we're going to reduce impairment to prevent the chronic symptoms that require infrequent use of short-acting inhalers and maintain near to normal lung function and normal activity levels. And we're going to also reduce the risk by preventing exacerbations and minimizing the need for emergency care or hospitalization to prevent the loss of lung functions and for children to prevent reduced lung growth and have minimal or to no adverse effects to the therapy.